Hi, my name is Aisha Said. My student ID is 19010524. I don't have my current student physical ID with me, but I do have a phone copy since I graduated 2 years ago. So here it is. Okay, so today my presentation is going to be focusing about intergenerational issues and how substance abuse and domestic violence can impact an infant's mental health. And I'll be using a de-identified case about a young mother and her two children to demonstrate how these issues can influence a child's development through a socio-ecological model. So let's just go over the case overview. So the case is about Mary, a 25-year-old mother who's raising two children, Lisa, who's an 8-month-old infant, and Luke, who is 3 years old. If we go back into Mary's history, Mary grew up with a father who drank very heavily and was often very violent. So because of this, she became so emotionally detached and never learned what a safe, caregiving, or a healthy family relationship looked like. Now, as a mother, she finds it so difficult to raise her children in that positive and kind and nurturing way. She's got her current partner, Samuel, who uses methamphetamines. He works long hours during the day, but as a way of coping with his stress when he gets home, he does use a methamphetamine. And often, when it does get quite noisy at home or Luke does have a tantrum, it often escalates to Samuel becoming quite violent and Mary trying to intervene. Leaves the house being so chaotic or so unsafe that it ends up leading to a police intervention because the neighbors would have called someone due to noise disruption. So this case study is going to highlight the essence of what intergenerational trauma is and how that same cycle of substance misuse or domestic violence that Mary experienced as a child might actually be repeating in her own family. So let's start to speak about how it's been impacting Lisa. So Lisa is an 8-month-old infant who's been already showing early signs of distress. She's crying frequently, she's having difficulty sleeping, and she's already making poor eye contact. So these are already red flags to show that she's already having insecure attachment. We also should keep note that Mary did score quite high on the Edinburgh postnatal depression scale, which highlights that she's actually experiencing postnatal depression. And it's also important to note that this doesn't just occur just after birth, but it does actually occur during pregnancy as well. And it actually affects like stress, anxiety, and depression can actually affect the fetus that's developing in the womb because of all the stress hormones that's being transmitted from the mother into the placenta. It actually causes the child to feel so unsettled. It can cause feeding issues, and then later down the track, it can also cause emotional irregularities. So the fact that Lisa's already having trouble sleeping and her bonding difficulties can possibly relate to the fact that the mother possibly could have experienced antenatal stress. So let's speak about Luke. So Luke is a 3-year-old who his behavior is already reflecting the stresses that he's struggling with at home. He's already having frequent tantrums. He's already wetting the bed, and even the childcare has sent complaints that he's being quite aggressive with other children as well. So when we look at his case closely, Luke is only trying to seek attention from his mother, and all his aggressions and tantrums that he's chucking are just signs of frustration, but it can also be linked to childhood anxiety, or that's his way of coping with his insecurities. So there's a research that actually shows that children of mothers with trauma and depression are most likely to develop internalizing problems such as anxiety or and externalizing behavior like aggression. So Luke struggling with this can possibly highlight how children can absorb and mirror their instability, the instability that they have in their own environment. Now, if you look a little bit into intergenerational issues, it's basically going through traumas that start from as early or as far back as it can possibly go, and it seems to just mimic into the next generations. And if there's no one there to be able to identify the actual issue, seek the help, and try and change that, then these issues will never get solved and it will continue to grow. So, if we're looking specifically at this case, it highlights how intergenerational trauma is working. The fact that Mary's father was had alcohol abuse, and how violence shaped how she became as an adult, and how she's struggling with attachment, and how she's struggling with caregiving. But now that she's got her partner Samuel repeating that same pattern, um, instead of alcohol use, will be methamphetamine use, and violence, that cycle is still continuing. Now, this shows us how trauma and unhealthy relationship models, they pass on from one generation to another unless there's a protective factor or a strong intervention that's put in place. Now, let's look at this more in a socio-ecological model. So we're going to be using the Bronfenbrenner's ecological model. And this is just going to show us how a child's development is not just influenced by their parents or direct family, but there's a whole ecological system that actually is around them that can also influence it as well. So if we start at the individual level, we see that Mary is struggling with trauma and depression, while Samuel has substance misuse and issues. We got the microsystem level where the family environment is not safe, there's domestic violence, it's unorganized, and there's disrupted caregiving. And then we've got ecosystem level, so they're limited to family, they don't have a community support, and the financial pressure of having another child is making Samuel work longer hours, which means more use of his methamphetamines. And then if you look at it more in the macro system level, so we've got the stigma, we've got poor access to affordable services. So altogether, there's no outsource that can actually help, or they're not aware of any outsources that can actually help them. So now let's review the risk factors for infant mental health. So if we're going to look at both Lisa and Luke, they're already living in a very toxic and very stressful environment. We see Lisa's having poor sleep, she's frequently crying, she's already showing those early signs of distress and even insecure attachments. And even Luke, with his aggression and regression and his bedwetting again, um, he's showing signs of anxiety and even having his emotions, they're not regulated properly. If you look through the New South Wales Department of Community and Justice, they highlight how children that are exposed to family violence face a high risk of trauma or unsafe attachment and long-term mental health difficulties. So this case that we're reviewing actually reflects that clearly. So what possible interventions can we take? The thing we need to understand that it's not just a one-step intervention. We do need to break it down into small baby steps to make sure we achieve the bigger goal and we're not rushing into something. So first, we're going to start off by ensuring that Mary is on a continual screening for depression using that Edinburgh postnatal depression scale, and that we're making sure that both her children are having their developmental well-being and development monitored. We need to put a domestic violence safety plan in check, and possibly if it does seem to get worse with every visit, then might have to get child protection involved because it is part of our duty of care. Then we can also do referrals for Mary, where we can link it to GPs, to child and health services, and even a social worker just to assist with like different type of support groups. And then last but not least, we can also do a long-term trauma-informed counseling, parenting programs, and community support networks that help break this cycle. So for children and family health nurses, we need to be able to recognize these signs early and connect the family to those services straight away to prevent the children and even the whoever is experiencing the trauma, so in this case Mary, from any long-term harm. Now that we've reached the end of our presentation, as part of our reflection and conclusion, so this case actually helped me reflect to see that it's very critical to be able to see those early identification signs of how the children are, the development, and the harm that can possibly befall them as well. How trauma-informed care is really, really important, how making such services more aware to different families if we do suspect anything as well. And it's very easy to judge a parent as neglectful if you actually do not see the bigger picture and the history behind it. So Mary's situation is not just showing us how she's struggling as a mother, but how she's never gotten the chance as a child herself to experience what safe parenting is, let alone to reflect on her own children. So by using these interventions, we can break that cycle and help Mary get the support that she deserves and help the children be in a more safe upbringing and protect them. And you can see my references in the next slide.